she is my mother. And she is housewife. My father passed away. We are 4 sisters and 1 brother. We got her echo and ECG and echocardiography and got to know that one of her heart valves heart, it got weak to the extent of 50% and necessitated surgical repair of it. That time we decided, having realized the prognostic complicacy, we decided with the family members decided that we would get her treated in Singapore, and then we sought cooperation from the Parkway Health Agency Dhaka. Then, as they always do, in suggesting possible best solutions, they referred us to Dr. Paul. That time she got very sick and she could not respond well. She always felt suffocated that time, and she could not walk well. So we became anxious of her health condition.
They do not need a machine to breathe for them. They are breathing on their own. But they are sleeping throughout the procedure quite comfortably using drugs. They are like sleeping tablets. Okay, and the procedure is done through a small hole in the groin. We pass a tube from this small hole in the leg artery to the heart valve, and then we deliver the new valve through this tube to replace it inside the patient's old valve. And then once that's done, we remove everything, and the small hole in the groin is closed with a suture device. So the entire procedure takes about 1 hour from the time we actually give the local anesthesia to finishing and taking everything out. We've been doing TAVI, at least in Singapore, we've been doing TAVI since February 2009. I did the first patient in Asia. And so for the last 8 years now, or nearly coming 9 years, the device has improved a lot. We are now using a 3rd generation device. So the success rate also has improved tremendously, and we are looking at about 97 to 98% success rate. So usually right after the procedure, the patients spend the first night in the high dependency unit, and then subsequently the next day they are moved back to the general ward. And usually for most patients, they will be in the normal ward for about 2 or 3 more nights, and then they are discharged. And usually once upon discharge, I tell them that they are almost nearly back to their normal life, and maybe for the next 7 to 10 days they can do some light walking, and then after that it's really almost back to normal.
Solutions there, because in our country we may have there are many facilities here, but we don't have the facilities what we get in Singapore, because they are the operating theatre and the service system, nursing system, that are the base, so we go there.
Okay, and the procedure is done through a small hole in the groin. We pass a tube from this small hole in the leg artery to the heart valve, and then we deliver the new valve through this tube to replace it inside the patient's old valve. And then once that's done, we remove everything, and the small hole in the groin is closed with a suture device. So the entire procedure takes about 1 hour from the time we actually give the local anesthesia to finishing and taking everything out. So I think for someone like her, as you can see, she's quite elderly, and she's of small body size and also quite frail. So we know that in these patients, open heart surgery, they are at higher risk for conventional open heart surgery. And also, being frail and elderly, they take a longer time to recover, even if the surgery was uncomplicated. And for a patient like that, TAVI becomes a very attractive option or alternative to open heart surgery. So when I looked at her, and when we take the history from her and the family about all her other comorbidities, which is other conditions she has, and we also assess how fit the patient is, what is their body size. In her case, she's quite a small sized lady. Many of these things made her risk for open heart surgery higher than usual. And for such a patient, TAVI becomes a very attractive option.
And his professional ethics, admirable skills, his responsiveness, and his friendliness are beyond what words can describe. He very successfully operated on my mother, and after he took post-operative care of her very intensely. So it was very confident for us. He made us confident to get the operation. So we are very much grateful to him.
So she was referred by the Parkway office in Dhaka for the problem of a severe aortic valve narrowing, which means the valve is now very tight and the heart has difficulty pumping the blood out. And she was getting some shortness of breath on exertion. So when we see a patient like this with severe aortic valve narrowing and shortness of breath on exertion, that's becoming what we call severe aortic stenosis, which is critical. And normally we will advise a procedure to replace the aortic valve as soon as possible. And the options being either open heart operation or a procedure called TAVI, which is Transcatheter aortic valve implantation, a procedure where we can change the valve through a minimally invasive method without the need to open the chest or stop the heart. So Mrs. Rabia Khatun came with severe aortic valve narrowing, or what we call aortic valve stenosis, and she was actually getting breathless on exertion. And this is quite a serious condition, because we know that if nothing is done for the valve, then almost 50% of patients will die from this disease in 1 to 2 years' time. So after the initial consultation, where we discussed the options of both treatments, open heart surgery and TAVI, it was clear that an elderly patient like her, who's quite frail, TAVI will be a better option. And from then on, it was doing the workup for TAVI, which includes a CT scan and then a coronary angiogram, and then it was followed by the TAVI procedure in July this year. So we performed TAVI under local anesthesia and under sedation. So the patient is not intubated, is not under general anesthesia. They do not need a machine to breathe for them. They are breathing on their own, but they are sleeping throughout the procedure quite comfortably using drugs. They are like sleeping tablets.
Parkway Hospital's Dhaka office is the direct liaison office of Singapore Mount Elizabeth, Gleneagles, Parkway Mount Elizabeth Novena Hospital. We are trying to help those patients who wants to travel to Singapore from Bangladesh, particularly reports to the specialized doctor or the medical board to get some information regarding the patient's medical condition. What would be this patient's further medical treatment plan and cost and other things. So this is the main issue we focusing, because before traveling to Singapore, any patient or any family wants to know the further planning things, because there are lots of financial involvement for the patient's family, and because if this patient going to Singapore for the first time, they need some guidance from us. Initially, we send this medical reports, patient's local medical reports or any other country's medical report to our Singapore Medical Board. Based on that, they will, after getting the feedback from us,